Hi, good afternoon. My name is Tracheotomy Mills, and today I'm going to be demonstrating tracheostomy care. I'm going to enter my patient's room, knock, knock, knock. I'm going to close the door curtain behind me for privacy, and I'm going to perform my hand hygiene. Hi, sir. My name is Terry. Today I'm going to be your nurse. Can you verify your name and date of birth for me? Okay, so he has correctly verified himself using two patients identifier. Okay, Mr. Mills, so today I'm going to be doing tracheostomy care. Is that okay with you? Okay, so for this procedure, I would go ahead, I would raise the bed to a comfortable working height. I would place the patient in a Fowler's or semi-Fowler's position. I would deoxygenate and suction if necessary. I'm going to go ahead and I am going to set up my supplies. I remove my gloves. I'm going to set up my sterile field. Alright, I'm going to go ahead and I'm going to empty my supplies on my sterile field. Okay, so I would go ahead and I would fill each of the three sections of my container with sterile normal saline, and one of the sections I could fill with a 1:1 peroxide solution. So I'm going to go ahead, I'm going to apply my gloves. So for this procedure, ideally I would ask a nursing assistant or one of the nurses to accompany me for the procedure, and I would just task them with stabilizing the trach. That way it doesn't fall out of place or it doesn't get dislodged. So I am gonna go ahead and I am gonna remove my inner cannula. I'm gonna unlock and remove, and then I'm gonna put it in my soaking solution. Next, I would remove my salt dressing. I will discard my gloves. I would perform my hand hygiene and apply my sterile gloves. I'm just, based on the space that I'm working with, I'm just going to move things around so they could be in view of the camera. Okay, so I'm going to apply my sterile gloves. Okay, I'm going to remove this. Now I'm going to move my container back in view of the camera. Okay, so next I'm going to go ahead, I'm going to organize my supplies. I'm going to put my cleaning swab in my saline solution. Okay, so I am going to take my brush and I'm going to clean my cannula, my inner cannula. I'm going to scrub it inside out. Make sure that there's no secretion left. I'll discard my brush. I'll rinse my cannula. Okay, I'll replace it and lock it in place. Okay, next I am gonna use my cleaning swab that's moistened with my saline, and I'm gonna clean. And I am ensuring that I'm cleaning I'm cleaning the skin, I'm cleaning around the flange area, and I'm cleaning the stoma, and I'm cleaning at least 5 to 10 centimeters around the stoma and the flange. And as I do that, I want to ensure that the trach is stabilized. Discard. And while cleaning, I could use this opportunity to inspect the patient's skin and the stoma, make sure there's no irritation, no skin breakdown, no redness, no swelling. I'm gonna clean. And I'm ensuring I'm cleaning the flange area as well. Okay, now that I've cleaned, I'm gonna take my sterile gauze and I'm gonna dry, ensure that it's properly dry. The patient's skin, the stoma, ensure that it's properly dry. And then I'm gonna discard. I'm gonna replace my dressing. And for each procedure, whatever I do, I have to make sure that I'm stabilizing the trach. That way it doesn't get dislodged. Okay, I am gonna go ahead and I am gonna remove my tie. And as you do, if you don't have an assistant to help with stabilizing, you could ask the patient. So if they're able to assist, then they could assist as you Okay, I'm gonna replace my tie using the one-time method. And as you go, you replace the tie and you go around the patient's neck. You want to ensure that it's not twisted. You want to ensure it's not twisted on the back of the patient's neck to cause any skin irritation. You're going to make sure you're stabilizing. I'm going to go all the way around, ensuring there's no twist. And then I'm going to use the one tie method. And as you tie, you want to make sure your tie is not too tight, so as to cause any irritation for the patient's skin. Making sure I'm stabilizing the trach. I am gonna check my tie to ensure that it's not too tight. I need 2 finger width. You want to make it snug but not too tight, so I'm checking to ensure that it's not too tight. Okay, and if there's any excess thigh, I could trim it, or I could pad it, that way it doesn't irritate your patient's skin. Okay, so I've padded it, and if you use any tape, I would secure my pad with a tape, and I would ensure that the tape is not coming in contact with the patient's skin to cause any irritation to the patient's skin. So now that I have done that, I would reapply the patient's oxygen. I would make sure that the patient is in a position of comfort. I would make sure that the bed is in a low and lock position. I would discard my supplies. Ensure that the patient's call light is within reach. I'd remove my gloves. Perform my hand hygiene. And go document my procedure.